Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air each Sunday at noon on 100.5 FM, 92.7 FM, and 820 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today, we are pleased to be speaking with Iaisha Penn, a family nurse practitioner at Sovah Health, Martinsville. In just a moment, we'll get to know her better by chatting about her personal and professional path, and we'll also delve into the importance of breast cancer screening, particularly because it's Breast Cancer Awareness Month. So with that, welcome to the show, Iaisha. Thanks for being with us.
Hello. Thank you for having me.
Well, it's our pleasure. We like to start these conversations by getting to know our guests a bit better. What we know about you, Iaisha, is that you're a family nurse practitioner originally from the Martinsville, Henry County area, so you're practicing today close to home. You previously worked as a med-surg nurse and a critical care unit nurse. You later worked in nurse education while pursuing your master's degree. And today you are practicing in a clinical setting close to home, as we mentioned. Beyond those few professional details, what are some other aspects of your unique personal story that people should know?
So I think what makes my story unique is the fact that what drove me to actually becoming a nurse is that I myself was sick and I needed nursing care for 21 days. It showed me the compassion as well as what it takes to be a nurse, knowing and recognizing when our community needs us, that we need to learn to be compassionate, be caring, be able to provide that care, and understand that a lot of times when those families come in and we're taking care of them, that they're experiencing all of the same things that we have experienced, the hardships, having to deal with poverty, those type of things, that it does directly affect how we care for those patients. And so sometimes it requires us to make some adjustments and learn how to actually meet our patients where they are in order to be able to make sure we're making them healthier. So that also made me want to be a nurse, want to take care of people. And that's what I do, is I do try to put aside all of the things that they bring into the office and make sure that I'm caring for my patients and I'm trying to get them to be healthier, whether it's through educating them, whether it's through making sure they have the medications they need, as well as knowing the resources that we have in our community.
Well, I was going to ask you as a follow-up, my next question written down was actually about you in a frontline role and what it is about patient care and helping people that you personally find rewarding, but you just answered that. So you already knocked that out, explaining that personal experience as a patient yourself informs your approach to care.
I do value the fact that I am here for my patients. I'm not here just to write prescriptions. I do spend a lot of time with my patients, and I do genuinely care. I want to make sure that they have what they need, they have the resources that they need, and that we're working on their health together.
I appreciate that response, and I appreciate you doing 2 for 1 there. So let's segue now to our purpose for this conversation. We are recording in October, and it is Breast Cancer Awareness Month. Breast cancer is the cause of nearly 700,000 deaths annually, and it's estimated that 1 in 8 U.S. women will develop breast cancer in their lifetime. Considering these statistics and your clinical experience, Iaisha, what is your message to the public about the importance of screening and early detection as it relates to treatment outcomes?
Early detection is the key to breast cancer. It doesn't always mean that it's going to be a positive outcome, but the earlier that we can screen you, so making sure that you get the screenings according to the guidelines, the more likely you have the opportunity to be able to be treated sooner, to make sure that we're eradicating this vicious disease that is attacking so many people, both men and women. So for me, it's early detection, being able to go and get the screenings, having a primary care doctor that you can go to that is ensuring that you're making sure that you get those screenings, whether it's annually or biannually, or how often you may have to have those screenings done, but making sure those screenings are done early in order to be able to detect the cancer early as well as get the treatments a lot sooner.
And we were just talking about screenings, and one of the primary forms of screening for breast cancer is a mammogram, which is a critical tool for early detection. You talked a little bit about frequency, whether it's annual or biannual for mammograms. From your perspective, when should women start getting mammograms, and how frequently should they schedule them when considering, in consultation with their primary care providers, you mentioned, when considering risk factors including age and family history?
So when it comes to family history, so if you know that you have a strong family history for breast cancer, they recommend that you actually get a baseline screening at age 35. So you will start at age 35 for females who have a family history of it. You would start at 35 just to get that baseline so that they will have something to compare to in your later years should something come up. At age 40 is the actual guideline. So the guideline says that at age 40, everyone should actually start getting their screenings. And those screenings are going to be based off of whether you do it every year or every 2 years based off of your family history. So they kind of look at that. Each guideline, there's different guidelines that you can follow, says a different number of years. But the key to it is to make sure that you're starting that screening at age 40 in order to detect the changes early. So if you've had that baseline at 35, even if you have a high family history of breast cancer, the good part about it is that they have something to compare it to. When you do your first screening at age 40, there may not be anything that they see any different because it's their first image. And so the good part about breast cancer and having the mammograms is a lot of times the abnormalities that they find on those screenings are more than likely benign. There's very little chance. There's 1 in 8 women that actually are affected by breast cancer. So the good part about it is a lot of the findings that are found on those initial screenings are actually benign. So there may be something that we just need to follow a little bit more closely just to make sure, but a lot of them are benign findings.
And in addition to early detection through screening, are there other actions or behaviors people should take to manage breast health? And what advice would you offer someone about, sort of that general course of action or behavior in their lives to try to promote health?
So to promote health, I recommend that every woman or man, because men do get breast cancer as well, especially men who may have a high family history of having breast cancer, is knowing your body. And that's going to be with any health condition that you have, but breast cancer in specific is knowing the changes to look for. So you're looking for those skin changes. Is there something different about the skin? Is it more inflamed? Is there a change in the way it appears? Is there dimpling in the breast or the nipple? Those are the type of things that you're looking for. So knowing your actual body and knowing that something's different, whether there's a new lump that has showed up that wasn't there before, it may not be cancer, but at the same token, knowing that there is something different that is going on with your body that you're not used to. Some breast cancers don't present as a lump, and so a lot of people make that assumption that it's always going to be a lump. It could just be pain. There could be discharge from the nipple. There could just be redness to the breast, or maybe even swelling noted to the breast. So the thing to do is just know your body and know that when there's something different, to go and have it checked. A lot of people are fearful when they find that there's something different, but I always tell people the biggest thing is that when you notice that there's a difference, go to your primary care doctor, let them know that this is something different that I haven't seen, and so we can start those screening processes if we need to be able to early detect it as well as get you the treatment that you need.
That is great advice. Pay attention to your body, and if you see something that seems unique or out of the ordinary, it's probably a good time to consult your clinical provider and see if you need to get checked out. So great advice there, Iaisha. We appreciate you being with us today and sharing some of your expertise and knowledge with our audience. We are just about done with our conversation, but before we conclude, we do have a tradition here on the podcast, which is to close things out by asking our guests a pair of surprise questions. To keep things interesting, we have a list of 10 mystery questions that you can choose from. So if you would, please give me 2 numbers between 1 and 10, and I will ask you the corresponding questions.
Let's do number 3 and number 8.
Okay, number 3. What's the best piece of advice you've ever received, and why does it stick with you?
Best piece of advice. So I would have to say the best piece of advice that I've received would be to never give up. That even when you're faced with challenges, to always push through. A lot of times we face different things in life. Everything doesn't go on a straight path. So knowing that everything could possibly curve off and things can happen along the way, but continuing to be vigilant and never give up on any of your dreams, that would be my piece of advice that kind of has stuck with me throughout my life.
One foot in front of the other every day. That's how we get it done. And then you also selected number 8, Iaisha, and that question is, tell me one memory from your life that whenever you think of it, it makes you smile.
One memory. I would have to say it's kind of 2 memories. I have 2 children, and I would have to say that one of the happiest days of my life is when I gave birth to them. So those are my pride and joy, I would say. And so those are the things that make me happy.
Understood. As a parent myself, I can certainly relate. Well, listen, I do want to again thank you for taking the time to be with us and sharing your insight and perspective. And with that, that is going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to go to Apple Podcasts and leave us a 5-star review and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Iaisha Penn, a family nurse practitioner from Sovah Health, Martinsville, for being with us today. So thank you.
Thank you for having me. I've enjoyed it. Thank you.